What's up, guys? Very good morning. Today is 25th September. Yeah, 25th September, and it's 6:30 a.m. in Bangladesh. So right now, I'm just came up with another video from Sam the Pharmacist channel. In fact, this is just kind of a blog for what I'm reading right now. So in the last couple of classes, I have shared something regarding the angina pectoris, and to the it will be the continuation of the last classes. Like previously, we have discussed about stable angina and unstable angina. So in today's class, I'm planning to discuss about the third type of angina, which is called nocturnal angina. My Notion app is here, so I just made some notes on it. So nocturnal angina, or what we called angina docubitus. It's kind of an interesting name here. Docubitus, Docubitus, that is called docubitus. So nocturnal angina or angina docubitus, whatever the thing we are talking about, this is basically a different types of angina which is not related with the rest, not related with the exercise. It is totally different. How it is different? Basically, what happens, this type of angina is a bit related with the gravitation. So what is written here, this happens in recumbent position or sleeping position and not related to the exercise or rest. So it means basically during the nocturnal period, I mean during the bedtime, it actually happens. So when we sleep, we remain in a position, lying position, something like that, what we call recumbent position. So at this position, the patient may suffer from this kind of angina, and this is totally unrelated with rest or exercise. So this is basically related with gravitation or gravity, what we call. So what is written here? Connected to gravitation as it shifts within the body and results in increased ventricular volume and subsequently increased oxygen demand. So it means when the body is in recumbent position, ultimately the gravitation pulls the water towards the central level, and ultimately it helps to increase the left ventricular volume. So once the left ventricular volume is increased, it ultimately contributes in increased oxygen demand, which is not being replenished or not even being met by the current oxygen situation in the body. So ultimately what happens, the patient starts feeling that insufficiency and results in that anginal discomfort. And as because it is not related with rest or exercise, it is totally related with the sleeping position or the sleeping situation or recumbent position, or as it is related to the nocturnal period, that is why we call it nocturnal angina or angina docubitus. So mainly in this kind of situation, what we can do as a strategy, see, since it is not related with the obstruction in the coronary blood vessel, we cannot provide anything like nitroglycerin. I mean, nitroglycerin usually not help in these cases, but what we can do, we can reduce the left ventricular volume. I mean, the volume overload which happened because of this gravitation, we can reduce this kind of volume by using diuretics. Either it is a plain or it is a combination, we can use this. So ultimately the left ventricular volume will be reduced and nocturnal angina will be resolved to some extent. Now there is another disease what we call PND. PND means paroxysmal dyspnea. Paroxysmal dyspnea is associated with nocturnal angina or angina docubitus, and it can be resolved with nitroglycerin. This is quite interesting. I mean, PND itself a disease which is associated or to some extent related to the nocturnal angina or angina docubitus. For relieving angina docubitus, you need to take the you need to correct the sleeping position, as well as you need to take certain medications that contains diuretics, either it is a plain or combination. But if that nocturnal angina is also associated with PND or paroxysmal dyspnea, In that case, what you have to do, you have to take the nitroglycerin. So another term I need to mention here, this is called cardiac asthma. Cardiac asthma, basically during nocturnal time and during recumbent position, due to the gravitation, fluids may accumulate in the lungs. As we have said earlier, because of the gravitation, fluids tend to accumulate in the central portion and ultimately increase the left ventricular volume overload. At the same time, it may happen that the patient is suffering from fluid accumulation at the lung, and as because of these things, patient cannot breathe properly. So just think about, it is kind of a asthmatic situation when your lungs is not being able to take up the oxygen sufficiently. So in that case, we call it cardiac asthma. Yeah, cardiac asthma, and patient can breathe. So what we can do in this kind of situation, we can we can make the position be different than the typical position of a patient who is suffering from cardiac asthma, as well as these anginal episodes during nocturnal period. So the thing is that you need to add pillows, additional pillows. By adding additional pillows may help in this case, along with medications and further interventions. So this is basically a bit different thing. Typically we used to know that angina is basically of two types: stable and unstable. Stable is stable and unstable is unstable. That means without even taking rest can't help the patient for relieving the pain. That is called unstable. And if it is stable, means if you take rest, your pain or discomfort will be alleviated. But in this case, the situation is different, because this is totally unrelated with the the pain, the rest or that exercise situations. So this is basically because of the gravitation. That is the silent killer at that time. Patients will feel anginal episodes, or that is kind of discomfort during the nocturnal period because of their supine or lying position, recumbent position, that ultimately makes the body just accumulation of fluid, and ultimately contributing to the increased left ventricular volume. So I think it's quite enough for today. We just learned a couple of new things, like how gravitation makes the patient a victim of nocturnal angina or angina decubitans, what is PND and how PND is related with nocturnal angina, and what is cardiac asthma as well. So how we can mitigate these things, like cardiac asthma we can mitigate by using or adding additional pillows along with medications, and for PND or paroxysmal dyspnea we can use nitroglycerin at the same time, and basically only for the angina decubitans or nocturnal angina we need to take diuretics, either plain or in combination, just to reduce the extra volume or to reduce the left ventricular volume overload. So ultimately this is how we can help the patient. So I think it's enough for today. Maybe in the next class I will close this angina classification sector. The next class will be on variant angina. So ultimately all types, the 4 types of angina will be covered. If you didn't see the previous videos yet, like the videos on stable angina and unstable angina, you can just go and check my channel over there. The videos are there. So I think at least you'll be benefited. This is kind of a vlog, so I'm just revisioning myself. See, this is not like I'm gonna teach you. I'm just reading myself, and made some notes here, and I just want to keep it documented, or I just want to make it as a record. So that's why this idea of vlogging came here. People usually do vlogging on different things. Now I'm doing vlogging on studying. It's a bit different, bit weird, I know, but at least I think it will help me as well, and help you as well, I think. So hope to see you in the next video. Till then, bye bye.